Okay, I'm going to go ahead and start things off this afternoon. Hi, everyone. Thank you for joining today's webinar, What AI Can and Can't Do for Public Health. My name is Amanda Clark. I'm the Director of Meetings here at NACCHO, the National Association for County and City Health Officials. Today's webinar is with one of NACCHO's Diamond partners. We're thrilled to have them, affiliate business partner Metopio. Helping public health professionals nationwide to save time, simplify processes, and gain understanding, Metopio is a data analytics tool that transforms complex data into clear, actionable insights. Purpose-built for speed, collaboration, efficiency, and impact. They empower organizations to navigate community health challenges and drive meaningful change. Share a few housekeeping notes here. This webinar is being recorded. The recording will be available to all registrants along with the slide deck, and we will share that out next week. If you're watching live, we encourage you to join the conversation. Let us know you're here in the comment section and where you're coming in from. Please type any questions that you may have. We will save time for that using the Q&A section. I know it's tempting to just type your question in comments, but it's much easier for us to track if you do that in the Q&A section. Thanks in advance. So without further ado, I'd like to introduce our speakers. Will Snyder is CEO and co-founder of Metopio. Prior to starting Metopio, he was the Chief External Affairs Officer at a $5 billion integrated health system in Illinois. In this role, he led all areas of public policy, community health, and community benefit for the largest health system in the state. Before moving to healthcare and technology, Will started his career as a journalist, working for the Wall Street Journal and NPR. He has an undergraduate degree from NYU and a master's from the University of Chicago. Jonathan Jafrida is CTO and co-founder of Metopio. Jonathan is a health policy professional with a special enthusiasm for how intelligent data analysis, visualization, and prediction can improve health outcomes and disparities. Holding a master's in public policy from the University of Chicago and a degree from Princeton, he's also a full-stack web developer and has leadership experience in technology, policy, and nonprofits. Welcome, Will and Jonathan. Thank you so much for being here today. I'm going to turn it over to you to get started.
Great. Thanks, Amanda. Excited to be here. So let's see if I can make this share work in our new exciting way that I have not been exposed to before until today. Go. Looks like it is working. So good day, everyone. It's really exciting to be here. As Amanda said, my name is Will Snyder. I'm the co-founder and CEO of Metopio. Excited to be joined by one of my other co-founders, Jonathan. We are in different rooms, even though we look like we're in the same room wearing the same shirts. That was entirely by accident. It makes me chuckle a little bit. But again, just thank you for taking the time to join us here today. We're very interested in your perspectives in addition to what we're going to share. We're in the world of AI day in and day out and are becoming very fluent in certainly what it can do, but are also very aware of those limitations. So at Metopio, just a little background, we're really focused on helping public health departments, hospitals, community organizations make data useful by turning complex and messy information into insights. And we do that with traditional coded software, but also more and more with generative AI. Community organizations across the country rely on us to help accelerate their community health assessment process, strengthen planning, make data-driven decisions, and also really be able to measure and understand their impact. So I think we know that AI is everywhere right now. And before we get started, I'd love to just pop a quick poll up on the screen just to understand kind of where everyone is in regards to deploying AI in your organization. So specifically, what impediments have you faced while implementing AI? This is multiple choice, and it ranges from everything to not doing anything yet to formally deploying AI tools. So excited to see what your responses look like. All right, hopefully we got those answers and we'll go through them in a bit. So yeah, I think what we all know is AI is everywhere right now. It's in the headlines, it's in our browsers, and increasingly in the tools that we're using every day. And it's very much hyped as revolutionary, but I think there, again, a lot of these impediments to implementation, as we can see with the poll results. There are issues with just setting up policies, being able to figure out what the use case is, finding dedicated funding streams and all the rest. So thank you for those answers. This is really helpful to see. Um, so here's the challenge, I think, and this is what that survey helps us really understand is we don't have the luxury or the time to really chase the hype or to ignore it. And so we really have to think about the hard questions in front of public health right now and also in software development. What's real, what's useful, and how do you make sure AI strengthens public health rather than distracts from it or causes misinformation or distrust? Public health isn't just another sector. It's not just a simple job you do every day. This is the intersection of data and policy, but ultimately the intersection of data and policy in people's lives. And so this is about trust, context, and equity, and absolutely around focusing on getting the right answers out of the data sets that we're interested in studying. So today we're going to frame this discussion around that landscape as it really is, where adoption is happening now, what's working really well, what policy consistencies are beginning to emerge, and what roadblocks we absolutely are still facing as we implement this incredible tool. And then we'll get really practical. I'll turn this over in a few minutes to Jonathan, and he'll show you what public health departments are doing with AI right now. So if we get this balance right, AI won't be another technology trend. It really has the potential to amplify the work of public health, giving professionals like you all more time for strategy, for partnerships, and ultimately for engaging the communities that you work with. All right, so we'll start just to frame the size and the scale of AI right now. So this isn't the perfect comparison, but I think it's a really powerful one to see. So in 2023, public health, the entire expenditure in the United States of America on public health was $160 billion. Just this year in capital expenses for AI, we're already at 350 plus billion. Now that's across all sectors. So that's why I was saying it's not the perfect stat to use, but it helps us understand just from basic implementation, we're already double what the entire public health budget is in the United States. And as a reminder, what this sort of tells me is that AI is moving very, very fast, and public health has to shape very quickly how it's used or risk being shaped by it. So the AI landscape in public health. All right, current adoption. Like, what are we seeing? So I think what we see is very clearly uneven adoption across agencies. Again, that depends on resources. It depends on policies. We are seeing those some more emerging policy consistencies, and there are consistent and persistent roadblocks to adoption. But I also think this is where we see a lot of excitement about what's going on. So you've got this paradox, right? On the one hand, resources are limited and demands are rising faster than ever. On the other hand, AI has exploded onto the scene, promising solutions, some of which might be what we call vaporware, but promising solutions and often leaving us asking the question, what's hype and what's actually useful? So when we talk about AI, the conversation often jumps straight into the technology itself. But at Metopio and in the conversations we've had with public health departments, really the way we frame the question is how can AI help us do our work better, faster, and with more impact without losing the human values and trust that make public health unique? So, again, as we look at this landscape, we see adoption. So it's already in public health, but it's not uniform. Um, some are automating reports, analyzing social determinants, or visualizing data. Others are holding back, unsure what's hype, unsure, how to deploy it within a safe environment. So again, there's that wide range. Um, I just want to go back to the policy consistencies for a second. It can feel like AI is the Wild West. Every day there are new models coming out. There are new. We saw something actually this week from the U.S. Census releasing what's called an MCP server, which allows AI to work with the census. So there's always something new coming, and it's again moving very, very rapidly. So how do you build an effective policy, or how do you think about effective deployment and ethical deployment when things change so quickly? And we recognize that policies often take a lot of time to move through approvals in an organization. Um, what we're seeing, though, is some key principles emerging in the policy space. And those are focused around privacy, transparency, and equity. So these themes are showing up not only in federal guidance, but also with state level policies, and even in the organizational codes of practice. So public health can't afford to treat AI as a black box. We need clarity on where the data comes from, how it's being processed, and whether outputs are free from bias. So the policies emerging will really help us shape that output ultimately and build trust with community members. Then we think about implementation. Even with interest and policies in place, there are real barriers. So workforce capacity is certainly stretched thin. Technical expertise can be limited in some departments, and data quality is inconsistent. So many tools don't necessarily integrate well with existing workflows or within that existing regulatory environment. So that's why it's so much we see today right now are pilots or one-off experiments rather than a long-term scaled solution. So that's why as we move forward, it's important to ask again and again, what can AI realistically do for public health teams right now? And just as importantly, what can it not do? And so that's what we'll focus on in the next slide. So jump right into what it can do. And I'm excited for Jonathan's section because he's actually going to go in and show you some great ways that that it can be used right now. Some great videos of some software. So AI is everywhere in the headlines. It's either going to save the world or it's something to fear. But you know, if we kind of think where we see really kind of low-hanging fruit or real options, this almost kind of works in order here. AI is fantastic for speeding up repetitive work. It can help summarize data sets. It can help create insights very, very rapidly and very accurately. It can also help when you're dealing with large, unruly data sets, especially qualitative data, to help you very quickly summarize it, understand what's going on. And it's a great first draft engine. It's probably one of the best first draft writers you can have around. And as Amanda said at the beginning, I'm a former journalist, so I can appreciate how hard it is sometimes to get writing reports. And what we see is generative AI is great at taking prompts and data and getting you at least that first draft. And then really at Metopio, what we think about is how you then go in and provide your human expertise to edit it and to make it a final product. And that also then really frees up time for strategy and community engagement. What we're thinking about too is the uncertainty in the data landscape right now. And the more you have time and resources to be able to pursue primary data, we think the richer your analyses, the richer your program design will be. And that's where we see there's real opportunity with AI to take a lot of that nitty-gritty off of the plate, and move that into a generative AI environment. And then you can really focus on data creation, data generation. So it's all great, right? Well, there are a few things that it can't do, and it really, at its core, cannot replace human judgment, expertise, or ethics. And we really want to come back to that over and over and over. Public health decisions often involve multiple facets and multiple variables. These involve values, context, and trade-offs that algorithms can't really resolve. So AI certainly can inform, like we talked about on the previous slide. It can help you organize and understand data very quickly, but it can't decide necessarily what's right or wrong for a community. And so if you're able to always be focusing with the community at the core, and AI as an assistant, you'll really, I think, be able to leverage the benefits of this technology. Second, I think we all know this, it cannot guarantee accuracy. It's prone to hallucinations. It can have bias depending on who built the models. and it will miss context if it doesn't have access to a complete data set. Third, again, what you all do so well at the local level, it's that local nuance. And so it's very easy to get wrapped up in like, well, look how quickly we got this insight, or we built this dashboard with this data. But if you don't have that local understanding and local nuance, it's going to fail to see the whole picture. And public health really is deeply place-based. People ask us where the name Metopio comes from. It's actually a combination of two Greek words, meta and topos. Jonathan and I both studied the classics in undergrad, so it's a great way to make use of our Greek language. And really, the reason we chose those two words is our software is ultimately about helping you understand places and the people who live there. And we think, again, AI has potential to accelerate the analysis, but you all possess and maintain that local nuance and that local knowledge. And lastly, AI cannot make decisions about priorities or investments. This is ultimately, a human interaction and a human decision to create budgets, to implement programs, and ultimately to see the outcomes. And so when we think about it, these four really are kind of the roll-up pillars under which AI is not quite there or not going to be capable for a long time of achieving these. So at the Nature 360 conference, we asked all of you and your colleagues to fill out a survey, but we asked people how they felt about AI. And I think the responses here tell actually a really important story. So we'll start with the high level. 84% are in some way leaning into AI, and fully a third are excited. So you see some of the excitement here. AI can help us move faster, be more strategic. Then about half of respondents said, they're curious and willing to try, they're optimistic about it, but they still need a little more information, or they need to understand what's really useful before really making a large investment or effort around implementing AI. And then about 16% said they're skeptical. They worry that AI might be a distraction, or worse, it could get things wrong. So the funny thing is when I see responses like this, I think about how I wake up every day and come in to build software with Jonathan and the team. And I experience all three of these feelings every day. I'm skeptical at times, I'm generally optimistic, and other times I'm really, really excited. So this is totally reasonable to go through this full range of emotions as you're working with AI and seeing what's possible. And I think, we have some data that supports this survey, which I think is really interesting. A recent McKinsey global survey pointed out that about half of organizations using AI already say they will need more data scientists than they have now. And far from shrinking the workforce, AI is actually creating demands for new skills, especially people who can interpret data, bring local context, and make ethical decisions. So I think there's a whole shift in what the skills are, but I don't think the work is going away. And there's certainly no evidence that we're seeing from our partners and clients in the space that jobs are going away. It's more how can you make this an effective tool to help people do as much community level work as possible. And then finally, it's worth noting that even globally, most organizations are actually still in sort of an experimental phase. So in this McKinsey report, only a third or so, or a small fraction, actually less than a third, would describe their AI use as mature. And so I think that's encouraging. It doesn't mean public health is behind. It's all part of a global learning curve. But the lesson for us is really clear. AI has enormous potential, but it's not automatic. It requires talent, it requires leadership, and really careful discernment to integrate it into your workflows. All right, so last little bit for me. So where does this leave us? Like, where are we going? And I feel like it's a bit of a cop-out, but it is totally the truth. Like, forecasting is really hard to pin down right now with AI. As I've said a couple of times just in these few slides, every day there's a new news story, there's a new product, there's a new feature that rolls out. That really is a bit of the Wild West. I believe it was one of the big tech titans was asked about AI and said, is this the new gold rush? And the person said, no, it's not the gold rush. It's more like when electricity was invented or dispersed in the early 1900s, that this is a resource that is everywhere. People are not trying to find pockets of gold. They're trying to leverage this entirely new thing and put it to good use. And as a result, there's a lot of stuff that goes haywire, but there's a lot of cool stuff that comes out very, very quickly. So forecasting is hard to pin down. I think where we are in seeing agentic AI get more and more dialed in, that's certainly what the next 6 to 12 months will look like. But there's a whole world of robotics, there are the wearables, all these things that are happening. So it makes it tough to sit here and prognosticate. But I do feel confident and be able to talk about emerging trends for public health. And really, three areas that we see most commonly at Metopio are around data collection and organization. So really making it efficient to be able to integrate lots and lots of disparate data sets into a single environment, being able to take lots of unstructured data, qualitative data in particular, and get that organized and at least do some cursory analysis on it right out of the gate. Something that we're very excited about and have been doing quite a bit of testing around are what we call conversational analytics. So, not having to think about necessarily coding a regression, but being able to just ask a chatbot, are housing and asthma correlated in my service area? And please consider controlling for X, Y, and Z. And the AI interface will actually be able to help you work through that kind of analysis. So we see that as a real opportunity to expand data analysis to subject matter experts who might not be statisticians or might not be data scientists. And the last one that I think is really exciting is the ability for everyone to build visualizations. So you don't have to be a specialist anymore in certain technologies or platforms to be able to create a dashboard, to be able to create insights on the fly. And so when you put all three of these together, it becomes a really powerful narrative for public health that you can work with lots of different data. You can ask questions of it to really uncover deeper insights about your community. And then you can tell that story back to policymakers, community members, and partners through dynamic visualizations. And lastly, I'll just leave you with this, that, I think a key piece, as we saw in the survey results, that a lot of places don't have policies, a lot of departments don't have policies in place yet. I think it's really critical to also have a way to think about your discernment with an evaluation of AI. And that's something that we've been building a white paper around, which we're excited to share with you all. But I would leave you with that really thinking within your department or within your collaborative about what is your process for evaluating AI. All right, and we're going to turn it over to Jonathan. And as we do a little switch with the slides, we're going to pop another poll up for you all. And Jonathan, I'll hand it over to you.
Thanks a lot, Will. Good afternoon, everybody. My name is Jonathan Jafrida. I'm Chief Technology Officer and co-founder at Metopio here. I'm going to give you some examples of everything that Will just talked about, how AI can amplify public health and where it can be useful, as well as where it can't. I want to start with where it can't. Let's discuss some of these challenges with using AI. I get it. Like, AI can feel really disorienting. This is the most expensive computer program ever made, and it can pass the MCAT, but it can't tell the difference between a dog and a muffin. We once saw an AI-powered data dashboard about Fresno, California, that was accidentally pulling in data about every Fresno in the country. And by the way, there's at least 2 other Fresnos. These are basic errors that humans wouldn't make. Too much autonomy can be bad for it. Say you're organizing community feedback. If you're not careful, AI is more than happy to make up community residents and their concerns to give you what it thinks that you want to hear. Ultimately, as Will made clear, AI doesn't have the faintest idea how it actually feels to live in your county or what makes your municipality different from its neighbors. And that's one of the most difficult things about AI. Is it smart or is it dumb? How do you use it effectively when it's a PhD 1 minute and dumber than a toddler in the next? So why does AI do this? Generative AI is just an especially advanced fill-in-the-blank machine. That's all it does. So if you were to ask it what your community needs, it's going to predict the answer based on whatever is most represented in its training data, or whatever it thinks you want or whatever it wants. So the challenge is to give it the right blank, not making decisions for you, but gathering and sifting through and synthesizing these disparate data sources and then presenting it to you for the next steps. You didn't get into public health to become an AI fact checker, and you shouldn't have to be. AI can't replace your expertise and judgment, but it can free up your time when you use it intelligently. In just the past year, our company Metopio has helped more than 100 local health departments and hospitals across the country automate their chalk and chip reporting process, saving huge amounts of time and money relative to the traditional consultant-driven model. We've developed guidelines while doing this for effective use of AI that balance what it can and can't do for public health. So first, use AI within a larger framework. Don't expect AI to do 100% of the work for you. Second, always keep a human in the driver's seat. AI is your partner, but you're making the decisions. Third, AI thrives on as much information as possible. Provide it with the context it needs to do its job. And lastly, recognize that AI still has fundamental weaknesses with quantitative data and facts. So I'm going to give a behind-the-scenes look at how these guidelines work in practice. How do we use AI within a larger framework? Well, a community health assessment is a great example. Whether you're in cycle or not, most of the work in understanding your community is very time-consuming and manual. It can take months to collect and organize and analyze the primary and secondary data, and there's a ton of back and forth. This is true whether you're just starting out on your CHA cycle or you've already finished, but you want to come back and revisit your findings out of cycle. We do things differently with this from the very beginning. First, we deploy our AI and automation with a focus on efficiency. Typically, the assessment process would start with a big meeting where you brainstorm what data sets and indicators you might want to bring to the table. You've got to go hunt them down, go look at a whole lot of websites. Instead, at the beginning of your assessment here, we start you off with a solid basis of themes and indicators that are available everywhere in the country and let you refine from there. You can use our large library of curated data to identify everything you might want to include in your assessment. It takes nothing to add additional indicators. And it can be organized the way that you want to report your CHA. Then we're going to automate pieces of the assessment process itself. Remember, when we use AI within a larger framework, we're not asking a single model to go from start to finish all by itself. Like that way lies chaos and made up facts, and then you get a report with PhD level vocabulary and it was written by a toddler. You don't want that. Instead, after we deployed about a dozen smaller models throughout the assessment process, we've reduced the time it takes to conduct a CHA by more than 80% while still keeping the human in charge. So let's look at how this works, starting with the qualitative data, meaning the focus groups and the interviews that you conduct with your community. When you upload your transcripts, an AI model reads every word in seconds and groups everything you heard from the community into the appropriate themes. This isn't a black box. You can see every quote it pulled out. You can edit and move them. You can choose which ones end up in your final report. Imagine this operating over 30 or 40 documents. It's magical. It frees up so much time. Through automation, it's easy to look across all your focus groups for commonalities. A sentiment analysis lets you see at a high level how your community feels about a theme. Now, let's jump to the dashboard where the entire CHA assessment is presented. I want to draw a distinction here between what we just saw, where AI is helping you read and organize 100 hours of transcripts, and then how you prioritize your needs, which has to come from your community. AI can't do this, but it can help you fill in the blanks of why you chose the ones that you did. What were the things that went into that decision? What was said in the room? Why did we come to these themes and not those other ones? Then we get to the secondary data. Now, one of our guiding principles, again, is to keep AI away from data because it has fundamental weaknesses with understanding numbers. That's okay, because through automation, we can make all the maps and charts you need for your report, hundreds of them, in less than 2 minutes. We give each one of them to an AI to read the data, read the image, and write a caption explaining what it sees from the context of community health. In this small contained environment, it doesn't make mistakes because it's only going to repeat the data points that you're giving to it. But you're still in charge. You can edit all the captions. You can regenerate them when you want. And you'll see that it's even able to call out specific data points in this map of Depression in Kane County, where it can point to the zip code and the town that had the highest rates and put that in context for community health. At the end of the process, we're using AI to actually draft your report once you've prioritized your needs. Because Metopio has the federal, state, and local quantitative data, the claims data, the community surveys, we have the focus groups and interviews, a large database of historic CHAs, and years of experience in public health, we can provide AI all the context it needs to fill in the right blank with the right answers. It can weave all these data sources into a narrative, calling out where it saw different pieces of information and where they aligned or disagreed. ChatGPT and off-the-shelf AI can't do this because they don't know anything about your community or your data, but properly constructed AI models can. Think of the AI here like a junior collaborator that's doing most of your CHA in like an hour or two while surfacing these insights you may not have otherwise had the time to identify. This puts you in the editor's seat. You can review, you ensure it reflects your community's voice, you approve. So let's look at that final product, the report. The interface here lets you generate and edit the CHA narrative right in a browser and collaborate with your partners. You can edit everything. You can even put it in your colors. AI will automatically identify the quotes from your focus groups and interviews and the quantitative data, the visualizations that are most impactful, but you can choose these as well. You can see it's connected to the visualizations. You can edit those in place. You can swap them out however you want. You can move things around, drag and drop, add a section, whatever you want to do. Now, you could draft all of this from scratch, absolutely, but it's a lot easier to edit a draft that's already pulled in all of the relevant information with transitions and explanatory sentences and definitions and everything. When you're done, you can export to Word to put it in your brand template or just go straight to PDF. There's a lot of AI operating in the background here, but what's presented to you is just the places where you need to make decisions. After the assessment, AI can transform the way you develop and implement your chip. It can suggest programs for you from a large library of evidence-based programs, help you develop a logic model from just an idea in a chat interface, zoom out to a broader roll-up dashboard, and then help you magnify your impact in much less time than before so you can focus on actually running the programs. Now, I want to talk about community engagement for a minute because ultimately you're conducting these assessments for the benefit of your community, and AI can help you engage them. We have a Health Atlas product, which is an interactive public dashboard for disseminating data to your community. Your NACHO member benefits include one free year of a Health Atlas. Usually this data is presented as charts, maps, and tables, but your community may not be so data savvy. Well, AI to the rescue. You may have noticed over the past few years that generative AI is really good at powering chatbots. A chatbot interface for your community members is a much more natural way to ask questions about the data that you're giving to them. They can use natural language, typos and all. What Zippo code has the highest education? This uses AI for what it does best, which is that human engagement with any number of community members at once. It can interpret what a user is asking for, regardless of how they word it or even what language they use. It's connected to the rest of the atlas. They can immediately pull up the visualizations that tie to the chatbot's responses. We provide the AI with the tools to fetch this data from the Health Atlas. It's not making things up. It's not trying to remember everything about your community. In fact, it can cite the source for every data point here. It can work with follow-up questions too. So you can ask a follow-up question, fetch that again, but for 2018. And it can even understand when you're asking to sort or filter the data in a different way. So when we ask about the most exercise, but the indicator is least, it knows it needs to reverse the order of the values. It's even smart enough that when you ask for something specific, like preventable hospitalizations last year, and it can't find that, but it finds something similar, it'll warn you that there's a difference. So it'll tell you that the latest data was from 2023 and not, quote, last year. Talking about data like this can feel much more natural to some community members, and our goal is ultimately that it's also more accessible. They have the ability to refine their question by talking to the chatbot and using the interface back to back. Notice, by the way, we've built in those thumbs up, thumbs down icons in every one of these answers so that it can ultimately learn from feedback and improve over time. So that brings me to our last guardrail here. Keep AI far away from data. So what is that all about? The underlying problem here is that generative AI, remember, fill in the blank machine, it approaches numbers the same way it approaches words. So if it often sees two numbers next to each other, like 2 plus 2, it knows the answer, the third number it usually sees is 4. But sometimes, like in George Orwell, it'll be 5. So you'll usually get a 4, you'll sometimes get a 5. That's not good. Recent advances in AI make this a lot easier to work around. So here's an AI chatbot that's connected to community survey results. You can ask a question, maybe you request a quick summary or a crosstab. We give the AI specific and limited access to fetch the data itself using SQL, using the database. So it's not trying to remember the whole data set. Instead, it's allowed to query it the way a data analyst might and then structure that data into a chart. This is like that Health Atlas chatbot, but it's designed for epidemiology and people who are already familiar with the data and just want to move faster. It's HIPAA secure, it can't make things up, And this is going to be available for survey and clinical data inside or outside of a CHA process. We've shown a lot of AI tools today, but I want to touch again on the importance of using AI responsibly. It needs to be deployed in a way that takes account of AI's weaknesses like we've been doing. So always be transparent about how you're using your users' questions and their data, how data is used to train AI, and make sure that you're deploying it securely. These AI systems are not secure by default and often actually pretty insecure. Your output's only as good as your input, so you need to have diverse training data that represents a variety of communities. Build in a feedback loop like you just saw so the system can improve over time. And pay special attention to improving the AI's accuracy, such as you limit its use to writing sentences or making suggestions rather than trying to calculate statistics. This is a careful balancing act, but it is getting easier over time. Last year at Nature 360, I said, in public health, we're not used to having nice tools. Now with AI, we're seeing a lot more flashy tools all over the place. But at the end of the day, the best measure of success is whether you're getting better output faster and for less.
Great, thanks, Jonathan. Super exciting. We've got a lot of questions, so hopefully we can dive right in for the time that we have together. I think you will. It's great to see the questions that sort of follow a very similar framework to how we have meetings internally at Metopio. But I just want to start on the training data. So a few folks asked, if you're building a community health assessment AI tool like we have, what is that model being trained on? How can a user feel confident in the output that's being created with the text as well as with the interpretation of the insights?
So a model that's trying to draft a community health assessment is trained on a number of things. First of all, most importantly, there's a difference between training the model that's then used on everybody's health assessments and then actually using your data in the model. We are not taking data from our individual people on the platform that they're putting in and using that to share with other users. Instead, we make sure that we train only on the highest quality information, much of which we actually craft by hand. Some of this comes from public CHNA documents that have been published or held up as gold standards. Most of it is crafted by hand in terms of this is the best kind of output for how to write this section of the report.
Great. And just a simple one that I typed an answer to, but I think it'd be great to have you articulate it as well, that within Metopio, we can't speak to other platforms, but within Metopio, we do not use any user data to, you'll be able to say it more articulately than I can, but that data does not go back to the source LLM.
So yeah, again, you need to be very careful with generative AI because anything that you put into a model that's then shared with others potentially could regurgitate that data to the other users. Again, public CHNA documents, PDFs at a URL on the web. First of all, ChatGPT, these models have already read every single one of those things. They've read every single thing on the internet. But you do need to have a clear separation. Things that users put into an AI tool should not be used for training data. At least they're not used by Metopio and other partners like us. When you're using other AI tools, you need to be very clear on whether they're going to use your data for training and potentially to, quote, improve their models, and are you okay with that? It is different when they use your data or they look at, what happened, why did it go wrong with you, and they use that to think about how to improve the model. But they shouldn't be taking your data and putting that into the mix that they're then going to use to answer everybody else.
Let me keep working through these because there are a lot of great questions in here. Regarding like missing context against the backdrop of checkbox features, how effective is AI at summarizing or interpreting qualitative data sets when AI is shown to not necessarily have a great understanding of causal relationships, especially ones that are sociological, or the ability to interpret culturally specific communication?
It's a pretty broad question. I think it gets to sort of what's the quality of the information and the reasoning that the AI is allowed to use. The newer AI models are really adept at figuring out how certain nuances relate to like actual information, what you can and can't say. Like they understand the concept like statistically significant. They know when and where that is and is not appropriate to use. So a lot of this does come down to careful trial and error of where can we trust what the AI is saying and where can't we? So I'll give an example. Like in the CHA process, as you're drafting that report, how do you know like what of those maybe hundreds of maps and charts that you want to actually showcase to the user and say this is important? So part of this comes from multiple different ways of benchmarking to say, is this finding meaningful? Like how important is this indicator? Where does it come from? What's the data source? Like, is it something that's really meaningful? Or are we talking about like, I don't know, how people get to work, which while important is not the core of, public health in your community. Then you tie that to what are the benchmarks? How do you compare to your peers? How do you compare to the county, the state, and the national numbers? You tie it to how do you compare with all counties or all municipalities across the country? If those things are all saying that you've got some kind of a fire alarm going off, then the AI will be able to pick up on that. It will center that in your report. As far as the question of how does this work with representing certain kinds of communities, that is a very difficult problem. That's correct. One of the things that you can do is always make sure you're including some kind of demographic lens on your indicators. So you're not talking about just poverty. You're talking about poverty among different groups of people, and they should be approached not as a monolith, but individually. You're looking for disparities. You're looking for where those disparities do and don't track. You're trying to tie that with what you're hearing in your qualitative assessment as well. This is all an area of constant, research and improvement. I think just really I'd come back to understand the limitations of your model, what you can and can't trust it to do.
Yeah. Kind of building on that. So a great question. Should an organization have policies in place before using AI and lay out what AI sites or programs are acceptable or off limits?
Do you want to take this one? I have ideas.
Yeah, we talk about this like for those of you who are slightly more seasoned in life, like myself, like you'll remember when like there would be really strict firewalls at work. Like you couldn't access Google necessarily. Like you couldn't. There were just every website was like red labeled. Oh, you can't touch this. You can't touch that. Especially news sites or like sports sites because they wanted everybody focused, on their jobs. And then people would figure out workarounds or smartphones came out on the market, and so people could bypass these things. So I there's no question that people are using things like Chat GPT or Claude or Gemini at work, maybe not in an authorized way. And it's usually just probably trying to get answers to something like how many people live here, or can you summarize this document? So there's that layer all the way up to like formal deployment within a health department or a health system. If you're going to do formal deployments, absolutely would start with a policy. We do have a webinar actually coming up on this very topic and are working with some academic partners on best practices around policies. I think what's important to consider is like what we mean by this. And I think, like, was it Kleenex? It became the catch-all for all tissues, products, and so forth. It's the same thing. Like we just say AI now, we just assume AI. But like what Jonathan was showing you is a very limited deployment of a large language model within the Metopio software. So it's not like OpenAI where you just go to a website and type stuff in. It is only running on data within the Metopio platform, which reduces the bias and hallucination risk. So I think just a policy will lead to a discernment process, which will then help you understand how to vet technology vendors for specific use cases around AI, which is really where we encourage people to focus. Like we have a problem with data collection, or we have a problem with impact evaluation. So we want to understand how AI can support that specific problem that we're working on, and not just everybody should use this chat interface to solve all their problems. Let's see, we've got so many great questions in here. There's another question here on frameworks or toolkits for establishing AI policies. So that's something we'll send out after this webinar as well. A question around PHI, Jonathan, because I think this is something that's like the next frontier is working with line level data. And so, how are you and your team thinking about this? And also, what are the security risks and concerns around AI working with line level data?
So with PHI, I mean, it's HIPAA, right? You have very different standards for data privacy and security. And that just gets magnified when AI is put in any kind of a clinical context where it could potentially be making decisions based on what it sees. Remember, this is a probabilistic model. 2 plus 2 is usually 4, but it's not always 4. And people have put that on social media that sometimes they get a different answer there. You don't want that making medical decisions. You don't want that deciding who does and does not qualify for a clinical trial. So when you're looking at line level data, I think there's first of all, you have a choice as to whether you're going to give the AI access to that data. Does what you're doing really require passing that data into the model? Or are you asking a model for help constructing maybe the pipeline that you're going to move that data through, in which case maybe just the field names and sample dummy data would be enough? That's an approach that we have used in the past. We can have an AI help generate the queries to pull data from a database where it is able to see the names of the columns and not any of the data inside of the columns. So there you don't need a BAA. You can have one to be safe, but you don't need a BAA because you're not passing the PHI outside of your systems. So I think it's HIPAA, but it's largely about you need to limit the amount of access you're giving to the model provider. You need to, of course, make sure that is never used for training. They're also not supposed to retain that data. You have a lot of other expectations in place. So think about what is the very most amount that you need to give to that model provider for it to do its job, or rather, what is the least that you can give to the model provider for them to do their job?
Several people have asked about the environmental cost of AI. So I know that is front and center for us and certainly a big part of the national or international narrative around AIs. Can you speak to how we consider the cost and mitigation?
Absolutely. This came up at Nature 360 2 years running. What I would say is everything that I just showed you from start to finish running a CHA in Metopio is the environmental costs there are less than what's powering the rest of Metopio that is not driven by an AI. The environmental costs magnify with the quantity of data you're putting in and the quantity of information you need to get out. It may look like we're working with a lot of information here, but we are using very targeted queries that are asking for very specific responses. And we're talking about, hundreds and thousands of words, not millions, not billions. The environmental impacts are also way bigger with videos and images than they are with, working through documents or writing captions to a map. That is not to minimize this at all. At Metopio, we do take a very careful look at how what is the environmental cost of the software. Data centers are a growing contributor to emissions and other things, but it is very small in the larger scheme of things, including everything else that you do.
Great. Thanks, Jonathan. And yes, it's again something that we're constantly thinking about. What are the offsets that we can try to pursue and so forth? And Jonathan and his team are very much ethically focused on minimal impact with maximum output.
Yeah, and one other thing I can add there is just when you use a service to run your model, the cost of that service to you is often going to be based on usage. That cost will also be a good proxy to you of what that environmental impact is. If you're not spending a lot, you're probably not generating a lot. If you are spending a lot, you're probably generating a lot because it really just ties to the electricity and the number of chips that you're using and so on.
Yep. Good question about academia. So if somebody's teaching a class right now or teaching the next generation of public health leaders at an MPH program or undergraduate program, what are essential AI skills they should be learning about?
I think understanding that this may look and act like a human, but it is not a human, and it's going to think about things very differently. Again, going back to it's a probabilistic model. It's picking the best matching word in a long sequence of words. It treats numbers the same way. It is incredibly fast. It is never going to be 100% accurate. Never. The technology they're doing is not capable of producing 100% accuracy because it's all about probabilities. That is a very important thing to understand. When you grasp that, you grasp that there are differences in how you need to use this versus how you traditionally use computer programs. When you use a calculator, you get the same answer every time. That's just not going to be true with an AI model, regardless of how carefully you train it, how carefully you put the data into it. There is a degree of randomness there. As far as other AI tools, I just would say that I think the non-AI tools are still just as important. You can't assess whether your CHA report was written well unless you know how to write well and you know what a well-written one looks like. You can't understand if it's explaining a chart well enough or producing a chart well enough unless you also have looked at charts, you have understood statistics to the degree that you can actually read those charts. I would not recommend using an AI to do something that you simply could not have approached otherwise, because you're not going to know whether you're right or wrong. And so you still need to have the same focus on those underlying skills.
Great. Okay, I have one or two more questions we'll get through and then we'll wrap it up. Let's see. Can you go back to the qualitative piece for a second? Because I think a couple of folks were asking additional questions around how the sentiment analysis is done, qualitative analysis is done. Can you talk about the comparison between like an ML model and what AI is able to do on the sentiment analysis?
This is actually a good question. You know, LLMs, so generative AI, has a lot of drawbacks, but it is fantastically good at natural language processing. It has just blown the field wide open. Prior to LLMs, sentiment analysis was extremely difficult. We used a state-of-the-art library for sentiment analysis prior to LLMs, where basically it takes every word in a sentence. It says, is that usually a good word or a bad word or kind of somewhere in between? It scores every word. It takes up the sum of all those scores, and that's the sentiment for the sentence. The problem is that's not how humans talk. Humans talk in terms of concepts. They talk in terms of ideas, negation, double negation. We don't think about, oh, this is a good word and I'm only going to use other good words with it. AI can understand that because it's just so much bigger than any other kinds of models. When we switched to an AI-powered sentiment analysis, the results were just, they were so much better. So that is one very limited case where we have a very clear understanding of what is a good sentence, what's a bad sentence. Like a human can read that and understand. Previous models struggled. AI does a very good job. Of course, there are other places where machine learning is much better. Anything to do with numbers, you do not want these LLMs near your statistics. They should not be, calculating rates for you. They can help you generate the methodology for calculating the rates. They cannot run the calculation themselves. You just have to make sure everybody's kind of in their place.
So last question is not an easy one. Then trying to answer everything I can typing as well. As public health professionals, we make mistakes in data analysis, processing, or reporting. We're held responsible and accountable. So in deploying an AI system that then makes an egregious error that impacts something vital, such as a budget design or risk factor, who is held responsible and who do you suggest absorb accountability? It's a little softball for you, John.
I mean, an AI does not have legal rights. So, I mean, there's nobody else to take accountability except the person who is using it and deploying it. And so it's going to be some combination of the provider that's deploying it and the client that is using it. That is, to the extent that that's a legal question, there are legal terms of use about that sort of thing. To the extent that this is an accountability question, it is, I believe, shared on everybody in the value chain, to understand where you could do better, where you can make sure that things are correct, and how you improve that from next time. There is a reason that every AI model you see out there has a little disclaimer under it saying, can make errors. They're trying to help people understand that, but there is going to be a learning curve as we all shift over to a world with a lot more AI-driven things, where we need to understand just because I see it doesn't mean it's true. And how does that intersect with, public health, which needs to be authoritative, but does make errors with or without AI? So I'm sorry, I can't give a straightforward, legal answer to that, because I think that we haven't come up with one yet as a society, but it is something we're always thinking about.
Okay, and one more, just kind of an easy one then. One question was, or one person was asking about how the platform does support like program management, performance improvement, and so forth, like the work of the chip and evaluation. And I know we talked a little bit about that in your presentation, but maybe dig into what we're working on.
Yeah, so we are building a program management module that enables you to track and manage programs and outcomes across whether it's a chip or performance management or grants management or something else. It's a lot of the same concepts. There are parts of this that are going to be similar to other platforms that do similar things. There are parts of this that are driven by AI and therefore can be much easier. So for instance, I mentioned, we have a large library of evidence-based programs, and AI is very good at searching through that library based on, whatever you type into it, even if it wouldn't match a traditional keyword search. AI is also very good at helping you work an idea into an actual program that has a concrete logic model that makes sense. So if you came to it and said, I think we need to support prenatal women, and we need to maybe, we should be providing doulas for, to help them get ready for birth and then maybe afterwards, like, I don't think that's anywhere in our evidence-based programs. And AI looks at those programs and understands what makes a good logic model, and it can then apply that reasoning to helping you craft a logic model that makes sense. So I'm talking more about the AI part of this because that's what this webinar is about. But if you do want to learn more, just reach out.
Yeah. Well, Jonathan, thanks so much. It's always fun to talk about what we're working on and also just to kind of analyze the broader landscape. There were a couple of questions about pricing, and I believe somebody mentioned in the chat that we're excited to be partners with NACCHO, and as part of that partnership, there's a member benefit for you all. So we do have discounted pricing, and happy to share that. I put my email in a few different places in the chat, but Amanda, we can also supply resources for you all to share. But really grateful for the opportunity, and wow, what a great discussion in the chat and in the QA. So we learn so much from everybody else when we get to participate in forums like this, and know that we're building with you all in mind, but also in partnership. So for those of you that had ideas and ways that we want to work together, please shoot us a note. We love testing, we love trying out ideas and so forth. So Amanda, we'll hand it back over.
Terrific. Before we close, I just want to yet again, on behalf of NACCHO, thank you to our Diamond affiliate business partner, Metopio, for hosting this webinar, and thank you all for joining. Just a reminder, we will be sharing the recording as well as the slides and any additional resources to all registrants next week. So thank you all for attending. Have a great day.